respected Secretary Shri Hemantji Kalme sir, respected Dean Dr. Digesh Barfiwala, our Chief Guest President-elect AOMSI Dr. Manjunath Rai, Key Speaker of the Day Dr. Piyush Sharma, President of CAOMS Dr. Ramkrishna Shenoy, and Vice President of CIAOMS Dr. Varsha Manikar ma'am, respected seniors and my dear colleagues. I would like to extend my warm welcome to all the distinguished dignitaries on this digital platform of FACECRAFT 2021 on the behalf of our esteemed management and faculty from Swargiya Dada Sahib Kalme Smriti Dental College and Hospital, Nagpur. We are pleased and privileged that more than 500 delegates from 7 different countries and more than 75 dental colleges from the different parts of India have registered for this webinar. I think this is really exciting time as so many clinicians from the dental field are motivated to grow in the area of facial cosmetic surgeries. Now kindly allow me to introduce our chief guest. He is none other than the President-elect of AOMSI, Dr. Manjunath Rai himself. Sir is working as a professor and head in the Department of OMFS in A.J. Shetty Institute of Dental Science, Bangalore. He is a surgeon par excellence and a humble soul, and I am fortunate enough to do my post-graduation under him. He is my pillar of strength, and he is kind enough to accept our invitation as a chief guest at such a short notice. It's an honor to have you among us, sir. Now I hand over the platform to our chief guest, Dr. Manjunath Rai, for his kind words of wisdom. The platform is yours.
Good afternoon. First of all, I would like to. Am I audible, Shalom? Am I audible?
Yes, sir. Yes, sir. Yes, sir.
Yes. Okay, yeah. Good afternoon, everyone. I would like to congratulate the management of Swargiya Dada Sahib Kalme Smriti Dental College and Hospital, President Shri Sharan Kalmega, Secretary Shri Hemant Kalmega, and the Dean Dr. Digesh Barfiwala for organizing this FACECRAFT 2021. One of the, very apt program and very interesting program by young speaker Dr. Piyush Sharma. And I'm very happy to see familiar face Dr. Ramkrishna Shenoy and Dr. Varsha Manikar, who are all very active in the so many of our web series in the MSI. And I'm happy to hear from Dr. Shalo that more than 500 to 600 people, both in this platform as well as the in the YouTube platform, are watching this program live. I wouldn't want to take much time, and I'm very happy that organizing chairman Dr. Shalu as well as Dr. Akshay Daga, both of my students from KVG as well as from AB Shetty. Nice to see the students are doing well, and they're making the institutions proud. I'm very happy and wish you all the best. And for the people who are watching this, more than 500 to 600 people who are watching this, this is something which Dr. Piyush Sharma is going to teach you, that these are the procedures of cosmetic. Both can be done under as the office procedure is mentioned as a cosmetic procedure, would be a technique sensitive, but can be practiced by all. Maxillofacial surgery is always increasing our vistas. So this is one more opportunity for many people to learn something new and get into your practice. So I wish this program very good luck, and waiting to hear from Dr. Piyush. Thank you very much.
Thank you so very much, sir. You are always a guiding part for me. It's a time to introduce our keynote speaker, Dr. Piyush Sharma, to the gathering. Dr. Piyush is a young, dynamic facial cosmetic and maxillofacial surgeon from Rafael Hospital, China. He completed his BDS from Rajasthan and maxillofacial residency from St. Mary Hospital, Hong Kong in 2013. After that, he went for his formal one-year plastic surgery fellowship to South Korea. Since then, he is actively involved in clinical practice in various medical university-affiliated plastic surgery hospitals. He is a registered practitioner in India, Hong Kong, and Macau. He is also certified by European Academy of Facial Plastic Surgery, and he is a certified trainer for Allergen, China. He is training young physicians in the field of facial cosmetology since 4 years. He was also a keynote speaker at various platforms in Russia, Canada, Thailand, China, and India. Due to his interest in training physicians, he co-founded the Asian Academy of Facial Plastic Surgery in 2019. Dr. Piyush is also a visiting consultant in Beijing, China, Gangnam, South Korea. I would suggest the delegates to stay engaged and keep us proactive throughout this webinar. A big thank goes to all of you for your presence. Have a great learning journey, and the platform is all yours, Dr. Piyush. I think Mr. Shivendu will help. Yeah, Mr. Shivendu, please help him and make him presenter. Or should I make him? कैमरा ऑफ कर दिया अभी आराम से चेंज कर सकते हैं.
Hello, everyone. Am I audible now?
Yeah, Piyush, you're audible, but we are not able to see you.
All right, not a problem. Maybe you can see, I'm not quite sure if this webcam thing is going to work later. So by the time it gets fixed, I'll try to start sharing the screen. Would that be okay for now?
Yeah, for sure. Thank you so much.
All right. So good afternoon, everyone, and respected sir and ma'am. I feel
Dr.
really.
Piyush, Dr. Piyush, I'm not able to see your screen.
Yeah, I'm just about to share. It might be a delay for a second.
Okay, thank you so much.
Is it better now?
Yeah, no, I'm not able to. Anyhow, you can carry on, and we are not able to see.
All right. Just let me know once it's fine. So am I audible now?
Yeah, you're audible, Dr. Piyush.
All right. Okay. So I'll just begin. Before I begin, so I'd like to extend my greetings and warm regards to all the seniors, like respected sir and ma'am. And it's my total pleasure to connect with all of you during these Corona times. I haven't been back home for more than a year because of this COVID situation. So I think it's been quite an introduction about myself. So I'll just get started because I think today's session might be a little longer, but I think it's going to be an interesting one as well. So I'd like to begin now, okay, with a quote that facial plastic surgery is not something which is meant to morph a deformity or not so aesthetic thing as beautiful. It's rather to magnify the beauty that already exists. And at the same time, who doesn't want to stay young and look beautiful? So, well, if it comes at that cost, yeah, why not? At the same time, because I do understand that all the microphones, they are, put on a mute mode. If there is something, if I'm not audible, please let me know because I won't be able to see your messages. All right, so let's get started with the anti-aging and skin rejuvenation treatments because it's quite a trend. And even in India, from last 3 to 4 years, what I've been observing ever since I entered my practice regarding cosmetic practice. So I managed to see there is a boom and there's much of a trend now. India is in India, especially in the mega cities. It's more of a trend that more and more people, they are getting into non-invasive procedures. So I have covered today's presentation in two things. One is going to be a cosmetic procedure. The other one are going to be cosmetic plastic surgical procedures. So with the daycare procedures. So let's get things started with botulinum toxin, which we commonly know as Botox. So Botox is a product which comes from Allergan Pharmacy, and so is Juvederm, which is a filler. So we will go by Botox, dermal fillers, then we will go with PRP and then microdermabrasion. We'll check thread lifts, lasers, chemical peels, hydrofacial, microblading, skin tightening, as well as other aesthetic medicine. So it has a totally a bigger scope of aesthetic medicine. So let's go through them one by one. First, let's get to review a basic understanding what we know. Like a face can be split into 3 zones, the upper 1/3, the middle 1/3, and the lower 1/3. So if we have a good idea about the anatomy, that would be quite well, so as to understand which areas do we need to inject, what's the depth going to be. And so goes true for the neurotoxin, which is Botox, or for the fillers. Fillers are also classified into different types. They could be temporary, they could be semi-permanent, they could be permanent, which stay for a rather longer period of time, just like fed grafting. So in this particular figure, I represent D with the deep ones and S with the superficial one. So this is how they correspond. And there are pictorial depictions of supraorbital, supratrochlear, superficial temporal, facial artery, as well as inferior labial arteries. And also depicted are supraorbital, infraorbital, and mental foramen that are located along the medial limbus. So switching that off to the next slide is botulinum A toxin, which is commonly known as Botox. So the Botox vial in itself comes in 2 dispensing systems. One is 50 international unit, the other one is 100 international unit. So it comes in a powdered form, it's not a liquid form, so which essentially means that we have to reconstitute it. There are different ways of reconstituting depending on the strength. Usually we reconstitute it with 2.5 ml of either it could be normal saline or just like sterile water. Both of them could be used. And at the same time, there are different sites where it has been allowed. So according to the FDA regulations and different country regulations, there have been instructions on where to give Botox shots. So I'll just demonstrate for 2 particular areas. One is the glabellar area. So this is for like the procerus muscle, and you can even inject over here. This will help you with not just a nice lift, but it's also going to help you with the wrinkles. And along that, if we have wrinkles over here, we can also add according to the wrinkles. And the unit would be like 2 to 4 units on each spot. So we can ask the patient to give us a frown expression, and you will get to see like there are different wrinkles along this, and we can go according to the creases. And this is the crow's feet area. When we ask a patient to frown as well as squeeze her or his facial muscles, then we can see wrinkles in this region as well. So there are 3 spots over here as well. So this not just helps with getting rid of the wrinkles, but at the same time, it's also going to give you a lateral brow lift. It's going to lift like this. Because of the corrugator and the procerus muscle, this activity this result can be obtained. So these are a couple of my cases. Like as you can see, I do understand these pictures are not that big or not in a high magnification, but I just tried to compile all of them together. So from the first picture, you can see it's the same patient. We gave her some Botox shots over here, like in the wrinkle region. And this is the follow-up. Botox comes with a latency of, let's say, 3 to 4 weeks. So after 3 to 4 weeks, you can observe this obvious symptom. And this is the area in the crow's feet. So these 2 areas we just saw. And this is another patient, like most of the Asian patients, because they do have a tendency for chewing more meat. So especially the Chinese and the Koreans, they eventually their protein intake is quite high, and they like to chew meat and lots of meat. So that leads to the hypertrophy of the mesenteric muscle. So in this particular patient, I also gave her mesenteric injections with Botox. This is another patient from our this is another patient from our workshop we conducted in India. So she's an Indian patient, but she also required this Botox injection. The reason being she was having TMJ clicking because of mesenteric hypertrophy. She was a habitual grinder, which led to mesenteric hypertrophy and also led to facial asymmetry. Her left side was quite bigger than the right side. And unless we deal with this particular, she won't be really motivated to chew from the other side. Because if we have a muscle hypertrophy, we tend to chew and bite just from that side, leading to more obvious facial asymmetry. And that's the other case. We also did some markings for Botox injections on the forehead. So in this one, these are like the filler injections, as you can depict from the regions. The first one, I'll just try to play the video. You can see. So this is an entry point, and we are filling in the eye trough region, tear trough region. So we just go like this. This is a safe point, and we are just filling in all these places. This is another Botox spot for this particular region. This is the Botox for mesenteric muscle. So even for mesenteric muscle, because it's also in layers, so you need to even arrange the depth. Sometimes it has to be superficial, and at times it needs to be deep. So what we do is we will do some markings. Otherwise, what usually happens if we don't have a very efficient technique, usually the patient still ends up with one of the sides bigger than the other one. So this is one of the side effects or adverse effects of administering of Botox. And so what we need to know, every time you pick up a syringe, you should visualize go products from Cytocare. There are different variations. Essentially a cocktail, and then they are injected into your dermis itself. You can see these are very thin needles. There are multiple needles which could range from 12 to anywhere between 80 or 100 needles, and there, you load it first and you then inject it. The whole reason behind this and the rationale behind PRP is the same. You are creating different, like multiple irregularities or multiple sites of injuries. What happens in that case is our body is triggered to generate more and more amount of collagen. This is how the anti-aging procedure starts, and this is how our body generates more and more collagen. In this particular case, this patient was complaining of like non-filled cheeks, so she wanted to have more of hydroxycollagen so as to look young. So that's why we injected hydroxycollagen matrix in her. So usually these procedures start yielding results after, let's say, 2 to 3 months. And if it's a direct filler, which is meant to augment the nose or maybe augment the chin or tear trough, the effects are very immediate. So these are a couple of my cases which I have treated using a different cocktail and a combination of different kinds of medicines depending on different skin conditions. So as you can see, like we obtained this kind of result, and these were the final results we managed to get. And yeah, these pictures are for myself. 1, 2, 3, and 4. I have an active acne spurt, and yeah, it resolved with time. I wish I could show how I look like now, because but the webcam is not working. All right. Okay, let's go for the next one. Okay, this is microblading or eyebrow tattooing, or it could be even done for eyelashes, eyebrows. It could be even done for side buns on your face, for mustache. Yeah, all these things. So it's basically designing using a permanent tattooing ink, and you can even give some depressions and scars so that the shape stays there. So it's also done after first applying topical local anesthesia, just like the case over here. Because the beauty salons, they are not permitted to use or inject the local anesthesia. That's why they're just allowed to go for the topical one. I'll just show you how it looks like. What appears to be here is the permanent ink, and this is how it's done. What happens in this case is the density will appear quite better, and the eyebrows will look quite full because of this color. So this is what happens when we are going for the procedure of microblading. And now let's go for quite a magical and transformational procedure, which is the thread lift procedure. There are different kinds of thread lifts, and it could be even included with the traditional facelift or its modification. So we do have a couple of thread lift locations which which could be targeted. So it could be done for the frown lines over here. It could be done for the nose, as in terms of augmentation. If we have to go for a nose, there are different kinds of threads which we insert from here and they reach here. So it will improve the dorsum. It will essentially give us quite a lot of augmentation, and could be filled in the smoker lines, could be even done for the lips to give it contour. Like there are patients who complain of thin lips or dystrophy over here. So for those kind of patients, we can do some filler injections here. And these are the crow's feet area, which could also be done. And for cheeks, you could do by lifting. You give a small incision here. I'll just show and share a picture just in a while for the lower face. So essentially meaning it could be done for everywhere, including the neck. So if there is a patient, he's looking for a daycare procedure, he doesn't want to undergo knife procedure, and he still wants to have good results. This is a procedure you can offer to the patient, and the patient would be quite satisfied and happy. So let me just show you how it looks like. So all these patients, they have been treated under local anesthesia. These are two different patients. That's for the first one. I just did that because there are two kinds of lining and two methods. So this is the linear method. I just went straight in and straight out and give it a lift because they come with a different thread system. And for this patient, we just did a vector design for her like this way to get rid of this nasolabial fold. We went through these 4 vectors. The circle here demonstrates like it needs to be augmented using a filler, and then we went this way and this way. We gave a lift because she had a saggy skin here. But for this particular patient, she just had some issues here, which needs to be lifted like this, and some issues here, which were lifted like this. And these are different kinds of threads. These are called the filler threads. There are another kinds of thread, which are like PPDO threads. They are for the lifting purpose. But these threads, they increase the amount of collagen. So there are different kinds. These are called filler threads. Let me show you how it looks like. All right, so let me show you. Yeah, that's for the first patient. This is before, and this is after. we targeted this particular region, as you can see over here. So this thing was totally lifted. We went this way. We did some fillers here to give it an augmentation. We went this way. Yeah. So even thread lift procedure goes with more of a kind of how is the anticipated. You discuss it with the patient, offer the patient choice. The thread lift procedure could be something which is considered minimally invasive and relatively risk-free. But if you enter into wrong vectors or uneven vectors, you might end up asymmetry. Okay, so let's go for the next procedure. Let's have an understanding of this. So it's PRP, which is like major applications in cosmetology as well as in traumatology. So alopecia, which is the hair loss, I'm sure most of the people are quite aware, like it's being used in different things. So this being one. The second one is wound healing, just like it's being used for long before it was used in cosmetology for knee or sports injury cases. PRP was like PRP extract used to be injected for that. So it's also used for skin rejuvenation and mesotherapy, which is like the combination. I just shared a video with you a couple of minutes ago. So this is the PRP segment. I'll show this case with you. So this is a patient. She complained of acne and dry skin and skin darkening. So we did two procedures. We did a PRP facelift, which includes injection of the PRP fragment. So right after the procedure, this is her skin, which appears quite taut and red and inflamed right at that moment because we injected PRP in it. It was not a topical one. So that's why it's called a PRP facelift. It gives your face a lift. And the vampire facial, because you did microdermabrasion using a derma roller or a derma gun, you just use them or a derma pen. You just create irregularities on the skin. And I think this is the fourth or the fifth day she just did. There was as you can see, like most of the area, there was not too much of a bruise, except this one you can very well appreciate because close to the eye, it's a rather vascular area as compared to the rest of the face. This area, and over here. So she like these symptoms resolved in a week or so, and the patient, as you can see, like the skin texture has totally changed. I think you can anticipate and appreciate from these pictures. And the skin is more even, not so rough. Okay, because of the picture issues, so I couldn't really show like, but on the forehead you can see the amount of evenness on the skin is quite good. Okay, so this patient also, we need to be careful about what we are injecting, where we are injecting, how much we are injecting, and if the product is legit or not. In the current scenario, I have been contacted by even a couple of suppliers who just approached me as because I'm conducting workshops at times in India. So they have even approached me like they can provide me materials for workshop and everything on a subsidized rates. And by their subsidized rates, they're just like selling, a very expensive thing at a dirt cheap price, which cannot happen. So we need to be very sure what we are buying because there are too many counterfeits. There are too many fake products available in the market. We need to buy the things from a rather authentic supplier. We can keep we can charge better from the patient if we are offering quality. Don't go for these kind of things. Otherwise, we might end up like this. I just shared a picture with you, just a picture. But trust me, I do have lots and lots of them. This is not something I'm trying to discourage to start a practice. I'm just giving a tip based on my experience. The product really matters, and definitely the techniques. So I'm pretty sure whosoever is going to start these procedures, they have a very good understanding and they will definitely have a mentor as to start the practice with. But things really get complex if you use a bad quality product. All right. Okay. So that was more of non-surgical procedures altogether. So if I can address some questions at this moment. So if there are some questions, I'd like to address them now. For the non-surgical procedures, I'll also like to hear something from you. So I'll be minimizing the screen, and I'll go back to the original chat box. I'll be taking the questions now. Okay. Is thread lift a non-surgical procedure, and how long it stays? Thread lift is minimally invasive surgery, I would say. It's not totally a non-surgical because we need to give a stab incision to the patient depending on where we are planning to give the lift from. So that could be done. And how long it stays, there are different kinds of threads. There are cork threads, there are PPDO, there are PDO threads, and there are another one, silicone threads. So the longevity could range from, let's say, 9 months to close to 2 years, depending on the product and depending on the brand as well. How many periodic sessions of PRP is required for facelift procedures? For facelift procedures, PRP is not an ideal choice unless the patient is having some other requirement for PRP. PRP, they come in different variants. I don't have few of them at my side now, or else like I would have shared them with you. If there are questions, I'd like to take them. PRP session and laser therapy altogether is effective for PK. I think PRP is good enough, and I'm not very much into the lasers, especially for the hairs. Yeah, so I know there are too many lights and UV lights and all these different frequency-based lights, and they have been showing and claiming. I know there extensive marketing, but if you follow any research paper, you would be able to check that treating with that particular frequency is not really offering or making much of a difference. So if you have to go for a hair loss treatment, I'll suggest PRP along with biotin supplements. And definitely if the patient is having 5-HRT in a higher side, then you might be, you will consider going for finasteride or at least minoxidil. You can start with 5% and take it up to 10% application. All right, so if we don't have further questions, I think I'll get started with the surgical part. And if we do have more questions, I'll just definitely take them or like right at the completion of this. So from here, I'll just take you with a journey for the cosmetic surgical procedures. A few of them you might be familiar with, and maybe there are a couple of names we are familiar being like OMFS residents. We know all of them. Today, I'll just show you like a few of my cases, and I'm afraid for the orthodontic ones, I didn't really manage to compile my cases and get them in this slide. So I just got some slides from the internet. So I'll be sharing both of them for a better understanding. Right, so let's begin with the forehead lift procedure. And okay, so I've got like 15 procedures on the list, which I need to soon. All right, so let's begin with the forehead lift, which is also called as brow lift. So a forehead lift is also known as brow lift, is a surgical procedure that tightens the tissues and corrects sagging in this area. And the incision is generally camouflaged in the hairline. I'll show you, it could be possibly at 2 regions. And this procedure may be performed alone or maybe in conjugation with different procedures, just like along with eyelid surgery or not. So there are 2 different ways. We will not go through all this much of text. I'll just brief you a little. So with aging face, you can see sagging, and you can even see like dropping of the, the guidelines are to just keep it in the hairline to keep it natural, and even for anatomic purposes, because we can encounter the supraorbital vessels in the nerves over here. So keeping that in mind, this is suggested. But over here, there are a couple of Asian patients who don't really have natural eyebrows, so they will be doing too much of tattooing. In that case, you have to feel the notch and then proceed. So for this patient, we proceeded like this. We removed, we sutured, and the suture line should lie here. So this will give her eyes. As you can see, with this area, you can anticipate from here and do a comparative. Otherwise, I would have kept this slide in the previous one. I kept it here so that you can have a look. Like this part got, a lift over here. So that's why it's called eyebrow lift or a forehead lift. If we have to go further forehead lift, we have to go this way if this part was saggy. But in this patient, she just had a complaint with this particular area, so we treated her. At times, there are issues like with too much of a fat pad descent over here. Even this procedure is not really good. So for those patients, we will be doing the blepharoplasty along with this procedure to yield effective results. Okay, let's go for the blepharoplasty procedure, which is also called eyelid surgery. So as you can see from here, they find it more cosmetic as well as more in a functional way. We have been like, these are called typical Asian eyes. So we call them, this procedure, as a double eyelid surgery. So like it looks like double eyelid now. Otherwise, there's just like one without any crease. So what happens to be for these kind of patients, like the upper incision, like before and after, this is how we proceed. Like we go first, and upper incision revealing tissues to be removed. We remove this tissue, we suture them again, and so is the case for the lower incision for the excessive saggy fat. Consider blepharoplasty if droopy or saggy eyelids keep your eyes from opening completely, or if there is a case with too much tissue and from your upper eyelids and can improve your vision. So this is the functional ability which gets improved. And the upper and lower eyelid blepharoplasty can make your eyes appear younger, and they could make it look more alert. And blepharoplasty may be an option if you have baggy or droopy eyelids and excess skin of the upper eyelids. So it does not need to be a fat descent all the time. It could be just excessive saggy skin. So in those particular patients, you just remove a thin strip of the skin. If that's involving and the fat descent, then you just take out the fat. And excessive skin on the lower eyelids, bags under the eyes. Okay, so I'll just show you a case presentation. Just like for this particular patient, he's a boy, and yeah, he didn't have this crease. He wanted to have this crease, and yeah, we just gave him this incision. Oh, I'm sorry, it's a girl. Okay, so yeah, and then we remove this thin skin over here because this is a young patient, so we wouldn't be requiring any removal of any fat. So this is why the Asian blepharoplasty is a little different from the other or routine or conventional blepharoplasty, because the Asians, they tend to get this procedure done just for the sake of double eyelids. So this is how, and the patient, and this procedure is totally done under local anesthesia, because you need to mark the incision, and especially when you're closing, you need to make sure the skin, it's not closing in tension, and you also need to measure the natural crease. So a blepharoplasty procedure is preferably done under local anesthesia. And this is the lower eyelid blepharoplasty. As you can see, this lady, she is having, a fat descent of the lateral fat pad over here. So we just did the repositioning of the fat pad, and we also took out the fat from here, like the excess fat. It's always better to preserve some fat, not to go too aggressive in those terms. And after that, we can just put on a bandage and the patient is free to go. Yeah, just try to avoid driving for definite reasons, and the sutures can be removed in a week or so. So there are two kinds of techniques, and for the lower one, depending on the site of incision, if you're going subconjunctival or if you're going subciliary, yeah, there are different approaches. So we usually, in my preference, I prefer to go subconjunctival because it reduces the chances for ectropion. And for this particular patient, this is a case of canthoplasty, because for a few of the patients, like they don't really have a well-defined, the so they do attach. So what we do is we just cut through, and just like it's a kind of V-viplasty thing, so as to increase and get the length. In this way, the patient is able to open the eyes a little wider, which is much required for Asians. Okay, so this is rhinoplasty, and I'm quite sure at some or the other point of time we might have encountered with trauma or something who might have undergone correction rhinoplasty. Might not be like aesthetic one, but definitely some of the other time we might have come across these procedures. So this is the nasal anatomy, and the upper portion of the structure of the nose, this is the bone, and the lower portion is the cartilage. And even for the cartilage, this is like the upper lateral cartilage, and then we have the lower lateral cartilage. Usually, if we for most of the cases we encounter in our daily practice, not over here, but in India, it's more of a DNS, which is deviated nasal septum. So there's a deviation because of this bone or maybe injury to this bone, which could even lead to some breathing issues or blocking of the nose or one of the nostrils. So even in those cases, we have to do septorhinoplasty and corrective rhinoplasty for those patients. And just like to understand the anatomy better, we can just call this is a nasal septum, which is followed by the upper lateral cartilage on both sides, and there's lower lateral, and this is the nasal septum. So once we go and incise, like there are two ways for rhinoplasty, like two conventional ways. One is the open one, the other one is a closed one. Open one, we just go like this, and like this. So this is how we can just elevate it totally. So this is called an open approach. And this is the closed one because we didn't open it from here. We just gave these incisions and we reached like this inside. So this is the closed rhinoplasty approach. So for this patient, this was a cleft patient operated in our hospital a couple of years ago. And this patient revisited us. And this time we have to do the rhinoplasty for him. We harvested an auricular graft. I'm afraid it couldn't be really appreciated here, but over here you can see. And then we used his septum, which was not so well defined over here. We have to harvest the graft because the cartilage, the lateral cartilage, superior as well as inferior, was not so well developed. So we just did that, and we were able to achieve satisfactory results right after the procedure. This is another patient. She came to us for an augmentation rhinoplasty. She wanted the dorsum and the bridge of her nose to be elevated, like over here and over here. As you can see, we went for this open rhinoplasty. We just opened it. We then split the cartilages. We went for a blunt dissection. We prepared the graft bed. We took out the septum, tried to augment it, and then we had to suture it and fix it. So this is another way. For this particular patient, because this patient didn't want to have any kind of an artificial graft, so we harvested her rib cartilage, and after that we just did the augmentation rhinoplasty for her. So this is a couple of days post-op, not at the time of operation. And now we'll be talking about the facial implants. So there could be different locations where we can go for implants. So they could be cheek, even they could be malar implants, they could be temporal implants, they could be zygomatic implants, different locations and different implants. And we can even go for the chin implants, which are used for genioplasty. So we do have all these options, yeah, for when it comes to placing an implant. If the patient is not willing to undergo a procedure, let's say, yeah, definitely nothing can beat BSSO when it comes to repositioning of the jaw if the patient is having skeletal as well as dental issues. But this is something rather not so invasive if the patient is generally just looking for a quick procedure, which is not too surgically involved. Yeah, then we can go for some implant procedures. So like chin implants, and next one is the jaw implants. So they can be placed in the mouth or in the jaw along with the incisions at the jawline or at the crease. And your incisions will be closed and with absorbable sutures or something. So for this particular patient, yeah, he went for this jaw implant. As you can see, it was designed using CAD/CAM technique. And over here, like this is the entire jaw implant. So the patient went for jaw implant, as well as these are the malar implants. Okay, so the next interesting thing would be lip repositioning procedure, which could be lip augmentation as well as lip reduction, cheiloplasty. So it's a technique to reshape an oversized lip, as the size, shape, and contour require both technical and artistic surgery to have given an enhancing natural look result. The aims of lip reduction surgery are to achieve a harmony with the upper and lower lips and keep the balance with the nose and entire face, as well as to attain an aesthetic relationship of the lips and contour, especially with the volume. And this surgery removes excessive lip tissue to reduce the size. The lip reduction procedure is performed under local anesthesia with regional anesthesia. So I'll just take you directly to the picture so that you can have a better understanding, and I'll just tell you how do we go. So this is also called the bull's horn incision. So it's designed just like a bull horn, like this. So the patient was complaining of excess of this. So we reduce this. This will give her lip a little lift. She also complained of bulky lip to reduce that as well. So we just incise this particular part as well, and we reapproximate it. So this is what the patient was looking for. So this is also called cheiloplasty. And even for this patient, he didn't want to lift, but he wanted to improve this thing. So we just went first the muscular sutures, and then the first, we don't need to go to the mucosal level. So the muscular sutures and the skin sutures, and it was closed over here. He just wanted a reduction in the size and a lip lift. As you can see, compare this from this. Good lip lift, and this particular area is not that long now. The next procedure would be auricular lobuloplasty and otoplasty. So lobuloplasty is like repairing the earlobes. It could be deformity, like since birth, or it could be a traumatic injury or anything. So any plastic surgery of the ear lobule is lobuloplasty and otoplasty. So the repair, it will involve the removal of an old scar and repositioning the existing earlobes to create a natural look. Dissolving sutures are placed in the earlobe. A piece of tape will be used to cover the area for extra protection. So, okay, these are the most commonly encountered cases. Like people, they are wearing heavy earrings and they will be, getting cut through, and then we can repair them through the lobuloplasty procedure. And this is another otoplasty procedure when you see protruding ears for a couple of patients. So this is the surgical technique we go. We just go a hind incision over here. We just harvest a graft, then we approximate the graft and suture it like this. While we are suturing it, we just need to pay more attention to the way we are actually suturing it, because excess skin has to be inside, has to be excised. After that, the concave part of the ear, which is looking bigger, what we need to do is we just need to measure it symmetrical on both sides. And then it's sutured very close, in very close approximation with the mastoid so that it stays in place. So the permanent sutures and the cartilage put very close to the skull. That's why it doesn't look like very detached. Okay, so for this particular patient, as you can see, for this one, they're protruding just like this. The skin is removed, the cartilage is reshaped, the skin is closed, and yeah, then it heals in due course of time. So liposuction, fat grafting, fat pad removal. So I'm pretty sure we are doing fat pad removal on a very routine case. That people are getting, dimples, and also this could also be, generally done in a daycare procedure when it comes to fat pad removal. But when it comes for a liposuction and fat grafting procedure, it's better to to operate the patient in a established operatory, because there could be chances of quite a lot of hemorrhage we have encountered unplanned and unprecedented occasions like that. So the facial liposculpture is a minimal invasive technique used to sculpt the face and neck with targeted removal of fat. The chin, cheeks, the jaws, and necks are most commonly targeted areas. The facial lipostructure in these areas may eliminate double chins, remove jaws. So this is more about the liposuction thing. It's also another procedure to look younger, definitely. And the approximate candidates, it may provide striking improvements in your appearance in just like 1 to 2 hours. I'll just share, like for the chin and jaws, a small incision is placed, and then we undergo like 2-minute anesthesia, and right after that we go for the liposuction. And it needs to be a delicate procedure because more and more sophisticated vessels are there in the neck and the face architecture. And these are different approaches. We can have a look over here. If we have to go for a submental liposuction, we can just give a submental crease incision, and we can just go inside with a blunt cannula. And this triangle is very well marked by the anterior border of the sternocleidomastoid, so it won't be piercing that unless we are using excessive force. So, but at times even with using blunt cannulas, there are incidences of bleeding or oozing of blood, which might, if not done in a very careful setup, might even lead to some cases which might require tracheostomy on a later stage. The bleeding on this side would not be too much, but for a couple of patients, especially the obese patients who usually come for these kind of procedures, for them, right after the procedure, there is a lot of seroma formation. So unless the seroma is properly drained, there is still an incidence of blocking the airway. So at times, like precautionary tracheostomy is also done for these kind of patients. And there are two different approaches. You go like this and over here, or in a combination of both could be fine for especially the obese patients. So as you can see, this particular patient, I have to conceal her identity, so I just hide over here, and this is right after the procedure. And it's always suggested to wear a tight bandage for the next couple of weeks, I would say like 6 weeks. Otherwise, there's always a free and dead space in this region because it's a gravity area. So, and it comes with, if you don't give this kind of bandage, it gets filled with seroma. So this is one of the patients we took. This is her thigh. We took a thigh, like grafting, for fat grafting from her thigh. And this is how she looked like pre-op. And this is her post-op. It's the same patient, like after 1 hour or something. There are a few of my colleagues who have asked, and like, why is this patient looking like, for the second picture, for the local population over here, they think that the patient is looking a little chubby and fat, which is not something beautiful, they consider. But because with the fat fillers, we always need to do an overfilling, because most of the times just 60% or 70% at the best is going to stay over here, even if you are doing the fat grafting with the nanofillers. So this is the fat which was harvested later. With these, it was transformed to nanofillers, and then these are the different regions where we did the augmentation. We deposited something here, here on the, even on the forehead, in the tear trough region, and this is the final result. Orthodontic surgery, I am sure they're masters of orthodontic surgery, and I think the number of orthodontic surgeries we're doing in India, I think we outnumber elsewhere, and it's considered very safe at our hands. And it's been there for quite a while, and this is how we are basically catering to aesthetic needs of the patient with skeletal as well as dentoskeletal issues. So there is a little bit of modification when it comes to the Asian ones, because it is more of a V-line surgery. The patients, they prefer their chin to be sharp rather than just this W designed, as you can see over here. They prefer it to be sharp. So this is one of my patients. I think I operated less than a week back. So we will just give the patient a bone incision in this form, and then we will split like this. We will bring these ends together. So it's just the difference in the planned osteotomy, and in order to give it this kind of shape. There another, I just posted another case on my, I guess I didn't include it here, but that was done for this particular region here. So we did an osteotomy over here, and I think that's just like a month ago, I guess, I remember. So we did also another osteotomy over here. And the osteotomy for the zygomatic arch is also done with for the patient with broad faces, like middle third of the face. So just like for her case, as you can see, like from this kind. So like as per aesthetic standards, like there are people who prefer this kind. And even if we go by the 1/3 golden ratio symmetry, still this one is more symmetrical. Okay, coming on to the next topic, hair transplant. I think we are doing quite a good number of cases in India as it comes for the hair transplant thing. And it's really good to see like more and more of the dental practitioners and maxillofacial surgeons, all of them, they're stepping into the hair transplant procedures as well. So a basic understanding of these procedures would be like there are two different ways. One is the FUE and the other one is the FUT procedure. So FUT is the follicular unit transplantation, and the other one is follicular unit extraction. So it depends on the site where you're harvesting the graft from. So for your FUT, you need to harvest a thin strip of skin with the hair is removed from the back of your head, and it's divided into different segments, like containing 1 to 4 hair grafts. The grafts are placed into tiny cuts made in the scalp. It's done in the same way as you do for FUE. You will have a scar in the back of the head, but it should not be visible because it's camouflaged with time. The head does not need to be shaved. Only the area where the skin is removed needs to be trimmed. Okay, for the follicular unit extraction, the back of the head needs to be shaved because you need to harvest multiple grafts from multiple sites. And after that, what you do is you will be just removing one by one. So you'll be extracting essentially all the grafts. And with the extraction, you can get to know like which grafts are better. And then, yeah, the hair transplant usually takes a day. It's quite a long procedure, and the patient can be discharged the very same day. So I'll just present to you a case for FUT. This is how we harvested the graft. And then because we have a team of harvesting graft, so we just split this particular slice into 3 or 4 segments. Then we, under magnification, there's a team of doctors who would be, harvesting one by one. And this is under the microscopic view. This is the microscopic view along with the follicle. So this is rather more efficient in my experience when it comes, because it actually doesn't really matter when it comes to just, it's not going to make much of a difference if you're doing 2,000 good harvests and rather than 3,000 bad harvests, if you're, or quality harvest. So it's always better to, in this way, you can have a direct vision of what you are cutting. So I think FUT is rather a better approach if the patient is quite motivated to undergo another surgical site, especially on the scalp. Okay, and it yields good results. Now, and FUE, I don't think I need to mention in detail. Maybe I can just explain, just like for FUE procedure, we'll find a good donor site. What do we mean by good donor site? It's just like the site which are with, we will take a dermoscope and we will just evaluate the quality and maybe extract one of them. We can see how many roots it has. If it's multi-rooted, yeah, then it's quite a good harvest, because it's going to, from a single follicle, you can get 2 or 3 hairs, like hair as in, and this is how it's going to appear more and more dense. And if they are just single rooted, yeah, I think it's better for like the anterior region. Okay, so for the facelift, a facelift is a surgical procedure that involves visible signs of aging, face and the neck, such as relaxation of the skin of the face, which causes sagging, deepening of the fold, just like between the nasolabial fold, and fat, which has descended or fallen or disappeared, or the jowls and the loose skin. And so this is what happens. Like over here, there would be a sagging, and even over here, there would be a fall. These nasolabial folds, these jowls, they will be more obvious. This is the sagging of the skin. So there are different ways to treat it. One is the surgical one. The other one is non-surgical. The non-surgical one I already explained with the thread lift procedure. This is the surgical one, which is done with a SMAS flap, which is a traditional procedure. In this procedure, you just need to go pre-auricular, and then you have to extend just like Heinz incision, and then you have to go like this. And even for SMAS, it could be differentiated into 2 kinds, like one is the high, the other one is the low level. So it depends on the level. If it's below the zygomatic arch, then it's a low level. If it's above, then it's a high level. So there are 2 of them, high and low. And SMAS technique, what's done is actually we enter into the SMAS layer. And when we enter, what we have to do is we try to mobilize it. We'll try and evaluate if this is the same thing. By repositioning, there are 2 ways. The first one is plication. The second one is imbrication. Essentially, what we will do is we will pull the SMAS layer. If we see there is an excess of SMAS, we will just cut it. We'll just plicate it. Cut, resuture this. So there will be a, this SMAS layer will be tense. If you don't want to cut, there's another procedure which is called imbrication, in which you can just imbricate it, suture it together by lifting up. And then eventually, while you're suturing it back, you can just go for the excessive skin removal. And if you encounter any fat, yeah, you can just remove that as well, if it could not be repositioned. So this is a patient. She underwent the surgery, and I think, yeah, you can see. So she went for MACS, which is minimal access cranial suspension and elastic thread suspension. And this is just obtained by the thread lift. Okay, now I'll just share a couple of cases which required like all these things all together. So this is one of the patients. She came for like even for augmentation rhinoplasty, and right after that she went for blepharoplasty. So all these procedures were performed together, especially, and even the lift was given using threads. And so, yeah, that's how I will conclude. With the facial cosmetic surgery, you can come as you are and leave as you wish. But all these things, they come with a cost. So even when we are choosing a patient, we need to be careful and just go with the procedures we are very confident about. With that, I'll just conclude my session for today, and I'll be more than happy to address your questions now.
Thank you, Dr. Piyush. This is Dr. Daga here. We've
Hello, sir.
had loads of questions on the chat box.
Sure, I'll love to.
Start. Yeah, I'll just quickly go through a few of them.
Sure, sir.
Dr. Bhatia wants to know if there's any allergic reaction from Botox or any other synthetic products so far in your practice.
All right. Okay. So with Botox, okay, I need to stop the screen. Okay. Just give me a moment. Okay. With Botox, there has been no reported allergy, but it's always a good thing. If you're injecting any product, just make sure it's coming from a legit source. And even in my very early days of practice, I used to do skin tests, but now I'm very confident that this product is coming from the authorized person. So for Botox, I don't really go for a skin test. But if you're new to practice, I would really encourage you to go for a skin test prior to injecting. Give it some time, and yeah, keep your emergency kit all along. If in terms of publications regarding Botox allergies, there have been no significant allergies as such. With Botox, what could possibly occur are complications. Complications which exclude the allergic response, but the complications would be injecting at a non-desired site. If you inject it at a non-desired site, you could even lead to ptosis, which is happening most of the time because um, if you're injecting it too deep in, and if it's not a landmark region, then you will end up in ptosis of the upper eyelid, which is like the most common thing which we encounter on a daily basis. And the good thing about Botox is we don't really need to be worried because these symptoms resolve after, let's say, 1.5 months at the max.
And your take with Restylane?
Restylane is a
same?
filler. Yes, Restylane is a filler. If the same as like while I'm discussing, I hope, and I'm talking about ideal situations, that all these products are legit. Well, in that case, you don't really need to go for most of the patient. They will give you a history like they have undergone a filler, unless there is any reported allergy. In the very first phase, I'll still suggest to go for a skin test a little bit, maybe wait for half an hour or something, then inject the whole volume. Even while injecting, there are anatomic locations we need to be careful about. Most of the complications encountered are in tear trough region because most of the people, they come for tear trough. And what essentially happens is people don't really take care and they will keep injecting the tear trough like under eyes because dark circles and under eyes are very prominent in our genetics. So most of the people, they will just keep filling them, and maybe they will deposit so much that it will start when it's in a gel stage right after the injection, it will not appear that bad. But if you're depositing right, uh, you know, at the nerve, so it's going to compress the nerve as well as vessels. If you're injecting in the vessel itself, it's altogether another thing because it's going to lead to embolism and later it's going to lead to blindness. So
Okay.
there are quite a lot of complications. Two places which I would really ask people to go for a blunt approach. By blunt approach, I mean to say that we can make the initial approach with a syringe, wide bore syringe, let's say 18 gauge. After that, we can go with a blunt cannula and deposit. We don't have to deposit using the syringe which any Restylane or Juvederm or any of the fillers is giving us. This is how you can avoid complications, especially in the tear trough region and nasolabial folds. Well, I'm not sure if we have started filling the temple region. I think people should master this technique before they even try to go for the temple region. That's quite a sensitive region. So yeah, people need to master before they start injecting. But for chin, I think it's relatively safe. Somewhere on the face, it's relatively safe. Tear trough, it's safe if you're taking all the precautions. and it's always good. I would, because all of us, like at some point of time, I was a trainee for this. So it's always good to have a mentor from whom you can seek suggestions. And it's really good if you can have him chair side. Otherwise, actually discourage from getting into cosmetic practice, because the people who are coming for any cosmetic needs, their expectations are really quite different from the other, because they are not actually patients. They are just like a client who is going to a hair salon. If you're giving that client a bad haircut, it's just the same thing. And unfortunately, the complications over here, they are not forgiving because it's on the face. So that's why we need to be more careful. Yeah, it's always good to learn first before we start actually performing the procedures.
Perhaps after today, you're going to have another couple of hundred people from India making you as a mentor.
Definitely, I'd love to answer anytime, not a problem. And I'm really happy to see, I got a very good opportunity from the president-elect and all other faculty members from the maxillofacial surgery. So that, because previously I was doing just like a couple of training courses, even in India, not for too long though. But my original motive is because if elsewhere, one of the best facial cosmetic surgeons, Dr. Joe Niamto from the US, he happens to be a maxillofacial surgeon. And all the maxillofacial surgeons, if we are doing like the complex skeletal cases, skeletal deformity in all these cases, I hope we should actually get into the facial plastic and cosmetic surgery for sure. Like get the due recognition. We are doing that. But what I mean to say is like due recognition as a facial cosmetic surgeon.
Yes, if people like you are there for pioneering such fields, I think we'll get there soon.
I'm sure there are too many doctors, even in India for now. They're doing quite remarkable work in even in facial cosmetic surgery. I don't know too many of them, but there are definitely.
Dr. Shekhawat wanted to know that we are doing PRP very regularly. Do you consider any candidate who should not be considered for PRP therapy?
Good candidate for PRP therapy. Okay, well,
who is not considered? Not considered. We do PRP regularly for it. Yeah, it's not a good consider. Not considered a good candidate.
Like I got the question. Right. So, okay. So there are people with some bleeding disorders. We definitely don't want to get PRP extract from them. There are people who are diabetic and more prone to infectious disease with lower immune response, or with some autoimmune disorders. For those patients, we'll definitely like to avoid PRP treatments. Considering, let's say, if we take a case for a PRP for hair grafting, for a person who is losing hairs, yeah, he's a good candidate. But if there is a candidate who already is missing the hair follicles, he already lost his hairs, well, in that case, I think PRP is not going to make much of a difference, because PRP is not going to all in all regenerate or new hair follicles, because that's not the way it happens. This is our biology. So we need to be careful about choosing these kind of patients. A patient or a candidate with active hair loss, or a patient with some deficiency who lost hairs. Yeah, if you're providing him nutrition with the aim of nutrition, if you're giving him PRP, in that case, PRP is going to yield good results. For the others, just like if there is a person who is not having enough hairs for, let's say, a couple of years, PRP is not going to yield any results for that particular patient for that particular area. It might increase the density for the other side. So I'm just quoting an example for hair graft. For face and all, in an active stage of acne disorders, I would discourage using PRP at that moment. First, we will try to arrest the active phase, and later we can go for the PRP. Dr. Bhavani also asked another question. Can PRP therapy be combined with other treatments? Yes, definitely. As I suggested, for the other ones, PRP could be used even for the mesotherapy with the skin needs. PRP, as in terms of hair, growth, you can, after the activation of PRP, you can even do microneedling. And if you're creating so many microneedling spots, the patient can be put later on finasteride, or the patient could be even put on topical minoxidil. Yeah, these are the combinations. And for face, there are endless combinations of PRP. They're endless. You can mix collagen with it. You can mix vitamins with it. Yeah, you can reconstitute it with anything. Even PRP could be done with Botox for skin tightening.
Dr. Jain also wanted to know that when do you correct these bilateral congenital preauricular skin tags? At what age?
What age? Okay, because for any cartilage, it's already, there are two school of thoughts for this. One is for the younger children. They suggest it's fine to get otoplasty done at a very young stage. That kind of otoplasty is not meant for the correction for the protruding ears. For the protruding, that's for if there is atresia, just like the ear lobule is not well developed, then it needs to be addressed in the early stages so as to avoid any psychological disorders related to this appearance. So that's addressed somewhere from 6 to 8 years. For any of the elective cases which involves cartilage growth, just like even for rhinoplasty or auricular cartilage, after their growth, we can still go for the first surgery from 15 to 18 years. There is another school of thought which advocates two surgeries, like the primary surgery from somewhere between 11 to 13, and if required, another surgery scheduled at a later stage.
Dr. Srivastava wanted to know that if there are any pre-diagnostic workup for case selection in a lot of these facial cosmetic surgeries procedures. Any pre-diagnostic work?
For facial cosmetic surgery, we just need to go through the golden principle, like of facial proportions, 1/3, 1/3, 1/3. And you can very well get to know like what all things are missing, which part is missing. And secondly, I think facial cosmetic surgery is more of a relative thing, because beauty standards and beauty aspect for everyone is quite different. For me, what might be beautiful might not be so beautiful for you. So we follow the golden principle in the very beginning. The second thing is we also give equal importance to the patient, because there are some procedures, when I was very new here and when I went for my fellowship training, I used to believe these people look absolutely good and they're still willing to undergo a massive surgery just because they think they don't look so well. So it's still, when they say like beauty lies in the eye of the beholder, I think the beholder is the person himself, how he perceives himself or herself. If that person thinks, okay, my chin needs some augmentation, you cannot convince a patient your chin doesn't need one. You have to listen to the patient. So for all the professionals, we still go with the golden proportions for facial aesthetics, and definitely aging process, we can continue and start and suggest to the patient. And if there is any obvious deformity, definitely that needs to be addressed as well.
Dr. Jaydev Solanki wants to know that if you're aware of some good institutions in India from where they can learn these procedures or do some courses after doing his dental surgery graduation.
Okay.
Are you aware? Could you share some?
I'm sorry, I'm not actually aware of too many plastic surgery design curriculums in India, because most of the plastic surgeons in India, what they have been trained in and trained for is more of a reconstructive work rather than cosmetic. And because I think it's quite a new thing which has come into being, it's not been too long since we have hit these fillers, and since it's starting getting famous. So that's the thing. I think there might be some colleges or universities which might be coming up with such a program. In fact, I have been approached by one of the universities, one of the leading universities, to start that. So I still hope that maybe sooner or later these things will start. From the ones I know, most of the maxillofacial surgeons, they're doing cosmetic practices, cosmetic surgeries. They're more into skeletal, like Le Fort osteotomies, genioplasties, and they're doing like really well. for those kind of procedures. And even scar revisions, they're suturing really beautiful, but not much into the cosmetic and especially the dermatocosmetic part. Not that I'm aware of for now. And rhinoplasties, like the ENTs are doing, the MaxFacs are doing, the plastic surgeons are doing, but I don't think there is one dedicated institution for now, as per my understanding by far.
Okay, Dr. Gawande wanted to know, coming to, you're discussing scars. So Dr. Gawande wanted to know, how will you minimize the scar in beard transplant by FUE technique? So he has an issue with beards. When you're transplanting for the beards, there's some scars. So that area, the beard does not grow properly, and it is not very aesthetically pleasing.
Right. So the incidence of scar in the beard transplantation by FUE, there could be a couple of things which we might do in order to reduce that. One, if we actually happen to harvest really good, like really good quality of the grafts. The grafts which we are harvesting, if they're too dense, the scar would be camouflaged. And the second is when we are choosing a punch, we can try to choose a punch which suits that, which gives minimal scar.
Okay. Dr. Jain would want to know that could you do something about the protruding eyeball by any cosmetic procedure in a hyperthyroid patient?
Hyperthyroid patients. Okay, so for hyperthyroid patients, because it's intraocular tension, I think an ophthalmologist is the right person to address that, because he needs to go into the chamber, like the posterior chamber of the eye, and resolve it from that, or depending on the tension on the eye, like, yeah.
Okay, so I have.
But there are definite surgeries which, if it's a protruding eyeball, there are decompression surgeries which could be done, as in terms of cosmetic procedures. We have done them, yeah, provided his intraocular tension is stable.
So there are a lot of other exhaustive questions regarding genioplasty and rhinoplasties, but I think that will be another day and another session, because rhinoplasties and genioplasties, orthodontic surgery, we might require a lot of time. So I'd love. Thank you so much for taking so many questions, and I'd like to hand over the mic to Simona, who would introduce Dr. Sunita, who would just want to say a few words before I give you the report. Simona?
Yes, sir. I now call upon Dr. Sunita Kulkarni ma'am for delivering the message given by Honorable President Shri Sharad Ji Kalmek, sir.
Thank you very much, Simona. A very good afternoon to everyone. The respected Chief Guest, Dr. Manjunath Rai, and the guest speaker, Dr. Piyush Sharma. I'm Sunita Kulkarni here, Professor Oral Medicine and Radiology. We have a special message from our Honorable President, Sir, Mr. Sharad Kalmek. And what he would like to tell you is that don't think about what dentistry can give you, but what we all as stakeholders can do for dentistry to take it to even greater heights and across the globe. Thank you so much. Yes, Simona. Hello. Hello.
Thank you so much, ma'am. I would like to request Dr. Akshay Daga.
Audible? Yeah.
Professor. Okay, ma'am. Thank you so much, ma'am. I'd like to request Dr. Akshay Daga, Professor, Department of Oral and Maxillofacial Surgery, to take over the dais for the thanks.
The tussle for facial surgeries, its best techniques, modalities, and most importantly, under whose domain it comes, has been going on for years now. Plastics, general surgeons, ENTs, MaxFacs, all have debated this issue ad nauseum. Dr. Piyush today gave a profound example that domain does not matter, regarding who the torchbearer for this exciting field is. What really matters is the ability to understand the basics, be adept at being at pace with the recent advances world over, and the experience you have in handling the materials, as well as the surgical blade. It was simply a beautiful example of an artist at work, which we saw today. We are deeply indebted to you, Dr. Piyush, for opening new vistas for the delegates and PGs here. I would like to thank our Dean, sir, and our esteemed management for letting us hold this conference at such a big level. Their constant support and motivation has always made us look for better and better academic avenues through our college. I would like to thank Dr. Manjunath Rai, sir, President-elect of ARSI, for sparing his valuable time. It's a double honor for us, as he has been a teacher for both myself and Dr. Shalu Bansal here. Always heartening to have our teachers bless us in such endeavors. Through Dr. Shinoy and Dr. Manikar's presence, we have ensured that the pioneer group of maxillofacial surgeons working under the aegis of CIAOMS is on board. Their presence and untiring efforts have borne fruit in the successful conduct of this program. Special mention to Dr. Nitin Verma and Dr. Dhirendra Srivastav, sir, who helped us in registrations from all over India and abroad. Mr. Shivendu, our technical partner, has helped set us this online webinar and was instrumental in the smooth conduct of the program. A warm thank you to all the national and international delegates for joining this program in large numbers. We have had a deluge of online webinars for the past 1 year, as you've all known. But seeing the attendance today, it only goes to show that good content and a well-conducted program set up by an exciting, young and dynamic faculty will always draw huge crowds. On behalf of the Department of Maxillofacial Surgery, we once again thank Dr. Piyush, and we expect him to continue this cooperation. And perhaps when he comes to India, you can come here and conduct a physical workshop so that we can all get enlightened by the newer and advanced techniques which you guys are practicing there in China. Thank you very much.
Akshay sir,
yes.
Just a simple question. Last year there was a like advisory or sort of information by DCI that the dental surgeons are not allowed to do all these procedures.
Do we have a copy of that? Do we have a copy of that? Because one of the advisories I saw.
Sir, if you give me your email ID, I can definitely give you all of that.
Because I do have one of the copies where it was seeked, like if a maxillofacial surgeon, he could perform the treatment.
It's not about maxillofacial surgeons. It's about dentists.
A dentist.
So
okay.
I'd like to interrupt interrupt Piyush here because perhaps you are there for the past 7-8 years, so you might not know. Dr. Rajveer sir, there's been a directive by DCI that as dentists, if we are able to practice, there's a proper directive. I don't have it right now, but perhaps I will share it with you. That it says properly that as a dentist, if you are allowed to do all procedures regarding the various specialities of dentistry, that they mean that if a BDS can perform, say, pedo work and perio work and facial surgery, extractions, impactions, then they should be eligible, and they are eligible to do any surgical and non-surgical procedure of the face till the time they are, there's a caveat to it, till the time they are properly qualified. So, in case they want to address.
Sir, I'm particularly talking about derma fillers and various procedures which Dr. Piyush has taught right now. There has been a directive from the DCI that as a dental surgeon, you are not allowed to do all these procedures. And regarding the government of India has allowed to all the homeopathic, the Ayurvedic practitioners to do RCT, extractions and such procedures. But we are not allowed to do these procedures as per the DCI directive. I have read the particular notice to Dr. Mridul She is my senior from my college, and she is doing all these procedures, and she was served this directive from the DCI that you are not allowed to do these procedures. I have seen it first.
Right, sir. So that's why the DCI had sent a caveat regarding that you need to be properly qualified before. After BDS, you need to be properly qualified. They have mentioned the qualification and the certain courses which you can be taking, after which you can follow these procedures. For
So
as far as
maxillofacial courses.
As far as maxillofacial surgeons are concerned, there is a proper directive which says that
you are a maxillofacial surgeon, you can do any damn thing.
Just give me 1 minute, sir.
Totally qualified. I'm talking about myself and other specialties as well. What are the certified courses that we have to do to practice such things?
Right, sir. So that as a VDS or as the DCI would have certain rules and regulations which you need to follow to the rules and regulations, because when we are living in India, we have to follow what the DCI says and what the government of India says. I, as a maxillofacial surgeon, can talk about maxillofacial surgery, not particularly about dentists as such, because there are certain rules and regulations which we have to abide by. What you're saying makes perfect sense, because if people are saying and people are coming against mixopathy, and then there is a certain question about people saying that why dentists can do certain facial procedures. That is why the DCI had come up with that. And they had said specifically that there are certain courses which they will be, which are mentioned, that if you can conduct and if you can take those and you get trained under those courses, then you will be able to, you are able to perform certain procedures. But as a dentist, only as a VDS, you are not allowed, according to DCI, to do all these procedures.
Sir, it is not about only about VDS or an MDS. It's about a dentist.
So there is a difference between, because for MDS, maxillofacial surgeons, as I can tell you, there is a completely different rule compared to other BDS and other MDS specialties regarding facial surgery.
Okay, so, sir. Let me quote. There are some people who are not properly trained in plastic surgery as such, can't do these procedures even as a maxillofacial surgeon. What about?
So that is, each to his interpretation, sir. Everyone has a different interpretation, and I think this discussion we can continue this discussion in the college with the other faculty, because
thank you, sir.
Also here. Yeah, thank you very much, and thank you, Dr. Piyush, for such a fantastic lecture on facial surgeries, cosmetic and non-surgical procedures. And we would definitely want to cooperate and get in touch with you later ahead. Especially when you come to India, we would definitely want to have a course conducted with your presence, so that you can really mentor the PGs and the delegates who have come and joined you in such large numbers.
Thank you, sir. Thank you. I'm really honored and very privileged to, share my experiences. I'm not here as someone to, teach, but I think I can just share my experiences, even for now and even for future. At any point of time, if the other members, they can very well easily reach me at any point of time. I might have a lag to to revert back, but I'll definitely like to see more and more dental fraternity members, including the maxillofacial surgeons as well. And I'm really glad to just know and what the previous doctor who came and mentioned. Yeah, so let's see and hope for the best. Let's get it on our side, I would say, like dentists and everyone's side, so that more people of our profession get the due recognition what we are doing.
Yeah, thank you, Dr. Piyush. Thank you so very much. We are really honored to have you on this platform. Thank you so much, and giving your time. I know your schedule was so tight.
No
really
problem.
honored us with your time. Thank you. Thank you. God bless you.
Thank you.
I think we'll call it off a day. Thank you for the wonderful presence of everyone. Thank you, everyone. Thank you very much.